my daughter Kate was 2 years old, approximately. I went to the basement of our children's hospital to the health records section, and I told them that I needed to get access to her health information. We had been referred to the United States, to the Mayo Clinic, to see a team of specialists down there. Kate was suffering from many serious illnesses that really couldn't be tied together with a unifying diagnosis. She was considered rare and complex, and she was a significant challenge to our pediatric team in Ottawa. And I didn't have access to her health information. I was her quarterback. I was her system navigator. I was her care coordinator. I was oftentimes her nurse. Every now and then I tried to be her mom, too. We went to that health records section. I said, I would just like to see her chart, and I can tell you what pages I need of the chart. I had learned so much over the first 2 years of our journey through the healthcare system that I was getting quite savvy at interpreting her blood work and understanding it. I was getting good at reading her diagnostic imaging, and of course the reports from the radiologists were always very helpful. And I was getting good at reading our physician's notes and understanding next directions. So I didn't need everything in the chart, but I needed pieces of it to take down with us to the Mayo Clinic, because of course her chart wasn't portable. I couldn't fax it down there, and I couldn't mail it down there, so I had to create my own binder. And this was one of probably about 5 or 6 binders that we have now in our home. And this has diagnostic information, blood work, from about, at that time, 8 different specialists that were looking after Kate. And so I had a really great interaction with the health records clerk, and she said, yeah, come on back, let me help you. And she wheeled out at that time, it was probably about a 4-volume chart for Kate. So if you want to get a sense of volumes of charts, how big they are, that's probably about a third to a quarter the size of what a full chart might look like. So she had about 4 at that time. And so I sat down, pushed the stroller into the back room. She found me a little room to sit in. I sat down. Kate's in my lap, and I'm flipping through her chart, and I'm tabbing it. And I give it back to the health records clerk, and she photocopies that for me, and then she lets me know what the fee is, because I've got to pay to get my daughter's health information out of the hospital. And then I go home with that information that she's photocopied for me eventually, and I sit down with my mom, who's a former nurse, and we develop a binder, and we collate it, and we tabulate it, and we make sure that it's in enough shape that it'll be helpful to the specialist at the Mayo Clinic where we are going to spend a week. That is really, sorry, I don't know where my clicker is. I didn't come up with a clicker. Anybody clicking? Oh, it's here. So that was my first experience with trying to access health information for Kate. Healthcare is getting more complex. And yes, Kate was a complex child, but if you think about anybody who's got a comorbidity and anybody who's facing a healthcare system challenge, the healthcare system is complex for them. So Kate, I don't think, was utterly unique in that respect. We're living longer with chronic and complex conditions. We have comorbidities that we're facing. We have what we're calling our seniors wave that is coming our way. And we are wanting to partner in our care. Patients are becoming more and more educated about healthcare. They're becoming more educated about self-care and self-management. They want information. We're often accused of seeking out Dr. Google. Well, why not? Why wouldn't I go and read up on the health situation that I'm facing and read up on the disease that I have or the condition that I might have? Why wouldn't I research my daughter's disease until it was diagnosed at age 4.5? Why wouldn't I research all the multiple conditions she was facing and try to find out what might be happening with her? We want to partner in our care, and the only way that we can truly do that is by having our health information available to us 24/7, unfettered, and portable and shareable in the way that we would choose to do so. We're integral to the healthcare ecosystem, and I think we're the ones who are kind of late to the party, and we haven't really been truly invited in by everyone in this room, but we're sort of forcing our way in. We're telling you that we're here and that we're interested and we want to partner, we want to be part of this process. I don't like talking about my daughter unless I have a picture up of her. Kate's 11th birthday was October 11th. She died November 30th, 2015, so she died 3 years ago. This is a picture of her when she was 7 years old, about a year before her death. And like I said, unfair to talk about her without having her in the room with us. This is my Crayola crayon drawing, and it's a little bit infamous because several physicians from Kate's care team and others that I've met along our journey has said, can I take this? Can I go and use this at conferences, or can I share this with medical students? Can I share it with some of the teaching rounds to show people what families are facing when they're trying to navigate the healthcare system? I did this one evening out of a sense of frustration. So I got out my markers and I drew a bit of an idea of what the journey was in the healthcare system for us. And I included our support networks. I included Kate's school, which is very important because they were health resources we were using there. I included all the medical and specialty clinics. I included, CHIO and Sick Kids and Mayo Clinic and the other hospitals that were involved in diagnosing Kate and involved in her care. And I mapped it out. And what's missing here actually is probably another full page from when we went through our bone marrow transplant journey, which was a whole other interprovincial, interesting journey. The reason I'm showing you this is to give you a sense of the role that patients, families, caregivers play in navigating the healthcare system. I did all of this without access to Kate's health information. And so I started creating more binders. Kate was often in the emergency department or in ICU or inpatient or in the ambulatory care clinics. And typically the question would be, well, tell me about Kate. Tell me what's going on with Kate. And I would say, I'm not even really sure where to start. I mean, there's so much going on with her, and do you not have access to her health record? And then that time we'll know they didn't. So we started strategizing about how we could bring that information and have it readily available. And I made sure that I included a picture of her on the front, of her being healthy. And I made sure that I included all of her updated information, all the specialists involved in her care, her recent tests, either blood work or diagnostic imaging, whatever it might be. And I started to carry this binder with me. This was an integral part of her care journey. And I actually started to coach other parents about how to make a binder because they were experiencing the same thing, same healthcare journey. And then I started to create files because, of course, we weren't just hospital-based. We were with the Community Care Access Center, so this is home care in Ontario. We had, 15 different clinics. This is audiology. We had assistant devices program. Kate had cochlear implants. She had an NG tube. At one point, she had a PICC line. So we had a number of different devices that we had to get access to provincially. We were involved in palliative care, so this is another one of our teams, 15 different teams. Ontario Medical Supply, we regularly needed medical supplies in our home, had to keep a file on them. None of their stuff was electronic, couldn't be accessed. This was one of our physios at the Ottawa Children's Treatment Centre. Again, no accessible health records electronically. And so I wanted to bring you everything, but I was saying to the team here at Canada Health Infoway, I would have needed a trolley or a truck to carry the bins and bins of information. These files are basically a one-drawer filing cabinet that we have in our home. Kate's health chart was at volume 12, paper-based health chart. When we finally did move to an electronic health record system in our hospital, and I asked for a copy of that, I was literally given a box with paper about that high piled inside, and here you go, here's her health record. Binders, we probably have about 10 of them. The other thing that patients will often do is carry around notebooks. So my notebooks are full of medical information. I actually have the IV bags from her chemotherapy treatments in here because I wanted to make sure that we were keeping track of dosing and keeping track of all of her health information when she was inpatient. And I do that because that is what kept her safe. That's what kept her from overdosing. That's what kept her from underdosing. That's what made sure that if one nurse came in with a medication, I said, actually, she's already received that we'd be able to partner in her care, and she would be able to work with me as Kate's mom and make sure that she was safe in her care. And I can guarantee you most patients who have chronicity or complexity disease are doing this as well. We probably filled about 12 of these over Kate's life. An incredibly complex journey, significantly hampered by what was available to us digitally. So at the end of the day, I just wanted to be Kate's mom. And I wasn't able to do that, so I left my job at Health Canada, and I was Kate's full-time care coordinator, system navigator, everything else that I mentioned earlier. This is something that we in the room can change. It's a small piece, it's a small sliver of the healthcare system, but it's a significant one. It's a one where significant change can be made in partnering with patients. The one thing that I'll implore to you all today, and I'll repeat it several times through my presentation, is that as you're developing these solutions around digital health or AI or electronic access to health records or health information, either in the provider's office or in the hospital or long-term care, pharmacies, wherever it may be, is that you partner and you work with patients to do this. There are patient advisors like myself here in the room, and they're spread across the country, and they have the inside knowledge of like how they need to access this, what they need access to, and when. So if you're developing this work, that would be my pitch to you, is to make sure that you're including them early and often, to make sure this works for everyone in the system, not just the health providers and the health administrators, but everyone in the system, particularly those who are living it. Patients are the experts. We live 365 days, 7 days a week, over 8,000 hours of lived experience with our health condition. Patients spend about 2 to 3 hours every day managing their health condition, and they're doing it over the phone. Sometimes they're doing it over email, depending on their healthcare provider. They're doing it electronically, and they're couriers as well. We can alleviate that system burden on them through digital health and electronic health and artificial intelligence mechanisms in healthcare. We can end the couriering of moving our information around. When my son was 10 years old, Kate was in Montreal for bone marrow transplant. My husband and I were split. I was with her here in Montreal in isolation. My husband was in Ottawa with my son. My parents were helping out. It was quite fractured and a lot of complicated things going on in our family. And I got an email that Jack was going to be suspended from school because his immunization record was not up to date. Because I probably had 2 or 3 versions of those stupid little yellow cards, because I'd forget to bring them to the doctor's appointment and they wouldn't always get filled in. And he was going to be suspended because his health record wasn't up to date. And I thought, what am I going to do? Luckily enough, I have an excellent doctor's office. I called them and I said, we need all of Jack's immunization information. And she said to me, Julie, don't they know he's over-immunized? Jack was Kate's bone marrow donor, and so he had every immunization known to man because he had to have all that immunity in place to make sure that the bone marrow he was giving her was going to be healthy and good and strong, and still he was going to be suspended from school because there was no electronic system of pulling all the immunization information together. We have something now called CanImmunize. A good friend of mine, Dr. Kuman and Wilson, was one of the architects of CanImmunize. I'm not sure how widely spread it's used. I'm sheepish and embarrassed to say that I'm not yet on it and using it. In Ontario, we have a digital yellow card. Again, not fully launched across the province, so sort of spotty. So it's nice to see something like that happening. It would be nice to see that something like that, simple and easy, affects all families to be rolled out substantially across the province, if not across Canada. Again, the reality, we have a significant role in coordinating our care. We are the ones who are impacted when we can't access our health information. When we can access it, it's improved communication, which is 90% of healthcare communication. It's improved patient safety. We catch things in our health information that might not be correct or might need to be corrected. It's better care coordination. It's better information sharing between hospital and home, and perhaps your family doctor, your pediatrician, and your pharmacist in the community. It's better system navigation. And if we have those things in place, especially better system navigation, we have a more efficient healthcare system. We have a more effective healthcare system. It's not as burdensome for people, and it's probably not going to be as expensive. So I want to talk a little bit about some of the digital health technologies that I believe are for patients. And there's debate and discussion, and I think that's really important about what patients really want. And some patients, want full access and unfettered to their health information, and some prefer to sit down with their provider and talk about their test results in advance. And I think that's an important dialogue and discussion to happen. Again, it goes to patient engagement and partnering with patients and bringing them into the conversation. And I put these up as dream statements. So the dream for electronic health records, at least for me personally, is it's portable. I can move it between my hospital and my pediatrician and my family doctor and my pharmacy. It's unfettered. So if I have blood work done and it's available an hour later, that pops up onto my electronic health record and I can access it. With Kate's information, what would happen is that we would hold it back for 2 to 3 weeks. With a child like my daughter, who was moving so quickly through the system and who I needed her information on time, unfettered at the right moment, a 2-week delay meant it was useless to me. So instead, I would work with her healthcare providers, her nurses especially, who were incredible, and I'd say, Christine, would you mind getting me her blood work? I need a print off of that. That takes up probably 2 to 3 minutes of Christine's day, so probably not a big deal, but how many patients are asking her to do that? Can you print me off my health information so I have it, and I have it readily accessible and usable? That's not an efficient healthcare system. Why not make that available to me as the primary care provider for that patient? Why not make that information available to the patient? No barriers to our information. Shareable. We have pop-up EMRs and EHRs right now in Ontario. I think there's approximately 60 in the province, and they're not coordinated. So that's fine. We need to have competition, and that drives price down, and that creates better portals and better electronic health records. But how do you create that seamlessly for the patient? I don't want to be going to 5 different hospitals, perhaps, because patients don't always visit one hospital to get my health information from them and from a different EMR or EHR. I want to be able to go to one place and get that. So that seamlessness is important. These are some of the common myths and barriers I hear about patients accessing their health information through an electronic health record. We won't understand the information and we'll be upset by it. That goes to what I call health literacy. That's a conversation between a health provider, a doctor, a nurse, and their patient to say, we're doing this test. We're not sure what the result might be. This is a high value, this is a low value. This is where I'm not concerned and where I am concerned. So when you see that information pop up on your electronic health record or your patient portal, which I'll mention in a minute, I don't want you to be concerned. We're going to have a conversation about it. Or you're very stressed, you're probably really anxious about this. Why don't you wait before accessing it, and we'll have a conversation about it in a week or so. But it's still important for that information to be available. Concerns about privacy and confidentiality? Yes, of course. Is our privacy legislation up to date? No, it's not. So let's get on it, and let's fix it so that we're entering a digital health era with up-to-date privacy legislation. We're going to burden our doctors with questions. So some of our patient portals have the function to have email. In the hospitals and the large healthcare institution settings, such as University of Health Network in Toronto, that have patient portals and full access to patient health information, they haven't realized that. It's a myth. If it does happen, then we find ways to mitigate it. Perhaps there's one-off circumstances where it may happen, and we find ways, maybe through patient relations or discussions with the patient, about how to mitigate that. Patients will have nothing to add. This is a comment about adding our own information into our health record. So the open notes philosophy, which I'll talk about in a moment. We do have knowledge and wisdom about our health. Again, we live over 8,000 hours living with our health condition and our chronicity. And so we do have valuable information to add. And it has been proven that patients find errors in their health records that need to be corrected. Actually, no, I'm not having the left leg amputated, it's the right leg. Or actually, no, that dosing information that's in there is the wrong one. Or actually, I'm no longer on that medication, and that should be removed. Patient portals. These are great, but right now it's a little bit of a game of whack-a-mole. They're everywhere. They're popping up and popping up and popping up. There's patient portals everywhere. Again, seamlessness. We need competition, we need creativity, we need to drive down price, but for the patient to be accessing 4 or 5 or 6 different portals, depending on what the provider is that's offering it to you, that's not acceptable. That's something we have to look at. I'm not an expert in blockchain, but I've heard about this blockchain thing. Is that something we look at? What are the other types of things that we can create a seamless portal and have patients be able to access their information through one touch of a button rather than many apps on our phones or many links on our computer and devices. Again, 24/7 access is critical and important. Patient health is not Monday to Friday, 9 to 5. That's how our system is set up right now. It's not an acceptable way to run a healthcare system, and it's not an acceptable way for people to be able to access their information. Open Notes. I'm a big fan of Open Notes. If you haven't heard of the Open Notes movement, I invite you to have a look at it. Dave DeBroncard is a big fan of Open Notes as well. If you've heard of Eat Patient Dave in the States, a big proponent of patient-centered care and patient engagement and patient partnership. The idea behind Open Notes is not only do we have access to the health information that's in our file, that's diagnostic imaging and blood work and maybe discharge planning and maybe our notes from our current inpatient stay, but it's also the notes of our physicians that have been caring for us. And again, it goes to patient safety, it goes to really great communication and patient interaction, it goes to a really strong patient partnership. We like to talk a lot about shared decision-making in healthcare. This is the opportunity for shared decision-making and to build up that confidence and that knowledge of the patient by creating a framework like Open Notes. E-referral, I'll go forward. You heard about Greg's story last night, and Terry's here. And there's nothing more to say about it. If you haven't seen Greg's story, Falling Through the Cracks, you need to look it up. You need to find a time where you can actually access it, either virtually or in person. It's not acceptable for us not to be included in referrals anymore. And there are opportunities to do electronic referral processes. No more lost referrals. The patients are engaged in the process. They know who they've been referred to. They know if that person has the right expertise in that specialty. They know if that person is available. They know if that person is on freaking vacation, right? And then we know where we sit in the system, and we know how to navigate the system back to our healthcare provider, referring healthcare provider if the consultant provider is not available. The phone is kind of how we try to do that right now, and the fax is how do we try to do that right now. They're not working. People are falling through the cracks, and dangerous situations are happening. EConsult, I'm a big fan of the movement around EConsult and virtual care. EConsult basically takes that road of trying to navigate the referral system and cuts right through. So this is where a provider, a referring provider, can refer to a consultant and say, I just want to have a conversation with you about whether or not I should be referring this patient. I'm not really sure. And they have that conversation, and then the decision is made, yeah, make that referral, or no, here's a bit of education about how you might manage that patient, and you can probably do it in your own practice. It cuts the wait time. It makes sure you get to the right specialist. It's a great opportunity for patient engagement and patient partnership and teaching the patient about their own health care, and it takes the burden off the system. I love this little graphic, barriers to access, and then the solution, EConsult. This is out of Ontario, the Centre for Excellence in Ontario, Doctors Liddy and Keeley, who developed EConsult in Ontario. And I'm a big fan of it, and I love this roadway analogy. Going from a really complicated system with lots of weights, with lots of system navigation, unnecessary testing perhaps because you're duplicating testing, and poor care coordination, to something that looks more like this. Virtual care, same idea as EConsult. Now I'm able to call up my physician, maybe over the phone, that's virtual, or maybe over face-to-face, some kind of Skype exchange or FaceTime exchange or WebEx or whatever the platform is. And I can say, hi, Dr. Mills. That's my family doctor, Heather Mills. She's amazing. I would like to get a prescription for massage and for mental health. I'm going to go see a social worker about my bereavement and my depression and my grief. Can we do that, please? And I don't have to go into the office. I don't have to travel there. I'm not taking X number of hours out of my day. I'm not filling up her appointment schedule for something that she might need to see for physical health reasons and a physical examination. We're able to do that virtually. Think about the accessibility issues for people who live rurally and remotely. Some of our patient advisors on the Ministers' Council live in Northern Ontario. My friend Rita Boutet lives in Keewatin, which is near Kenora. If Rita wants to access healthcare, she goes to Manitoba. She's over to Winnipeg, and it's a couple hours drive. That's where she goes to access her specialty care. What if she could do a virtual visit? So incredible opportunities here, creating equity, creating access, creating better efficiencies in the system. And it's not lost on me that, I don't know if there's providers in the room, they're like, yeah, how do we get paid for this? That's something we have to sort out, right? The providers aren't necessarily paid for phone calls and virtual visits. That's something that the provinces need to sort out, and we need to get on that. E-prescribe, another one. Not losing prescriptions, feeling safer. How many people get a prescription written and it's all scrawled, and then you sit your Starbucks on top of it, and then it gets all gooey, and then you give that to your pharmacist, and they're like, seriously? Right? What if that can be done electronically? What if the prescription doesn't get lost? What if that pharmacist can determine whether or not you filled that prescription in a timely way? What if that information is given back to your provider? And they can start a conversation with you. Julie, I see you didn't fill your prescription, and I'm concerned because that was a plan that we had developed together. Can you tell me why you didn't fill it? Really great opportunities for patient partnership and dialogue and engagement. So what are the opportunities for digital health? Developed with and not for, and not to patients. We want to be developing it with you. It needs to be early and often and regularly with this type of engagement. More health literate patients. These are patients who are engaged this way and partner this way, have better communication with their healthcare providers and with the system. They understand their healthcare better. They're more likely to follow their healthcare plans if they really have access to a lot of information. They are probably likely to navigate the system more efficiently and to be safer. They're probably likely to ask more questions and be less vulnerable in the system. Even myself as a medical mom, having gone through the system with Kate for 8 years, I'd still be worried about asking every single question that I had in an appointment. But if I had access to her health information and her doctor's notes, I could go back and review those visits and remind myself of what the conversation was, maybe answer some of the questions that I have before going to see the provider, and maybe have a bit more security in my knowledge base about Kate's health. I never felt that I was truly part of shared decision-making and truly partnered in her team. And that is a dangerous place to be when you're dealing with medical complexity and medical chronicity and a rare disease such as Kate had. And I look back on it now, and I'm filled with regret because I didn't have all that information. And I made decisions for Kate that I probably wasn't fully informed about. And I probably wasn't asking all the right questions. And I probably would have had more information had I been able to access her health record at all the institutions that she was at. Human interaction is still going to be the baseline. So even if we have all this digital health and artificial intelligence, and we're wearing apps on our body, and you're tracking my steps per day and what have you, we still need to have that conversation with our primary health care provider. Primary health care providers and the patient together are the quarterbacks of the healthcare system. So we still need that one-to-one interaction. We still need to have open communication with our providers. We still need their assistance in pointing us in the right direction about looking at our results and understanding our results. But we can have a more effective partnership with better digital health opportunities. I love this Dilbert cartoon. Some of the patient advisors in the room are going to recognize it. It might be a bit fuzzy, so I'm going to read it. Before I make my decision, I'd like to ask you for your opinions. It's supposed to make you feel engaged. And you're actually going to listen to us? Well, I'm hoping it'll look like that way on the outside. A classic interaction, sometimes, for patient advisors. If you're truly going to invite them in and you're going to have a conversation with them about how digital health affects them and applies to them and what they want from the digital health world, ask them, but make sure you're really, truly engaging and you really, truly want to hear what they have to say, because they're going to have some suggestions that are really going to blow your mind. So the dream that all of you in this room are going to be leaders. You're going to drive this forward. You're not going to wait. We're going to change legislation. We're going to change regulation. We're going to make sure this is accessible and available for everyone. We're going to make sure that if we're developing digital health solutions for providers and hospitals, that we're also developing them for patients at the same time. Not afterwards, because we're not an afterthought, but if you're developing portals for your providers, you're developing for your patients as well. And in doing so, things are going to get a little bit easier for us, and our health is going to be better, and we're going to be safer, and we're going to be more engaged. So thank you. Merci. I'm pleased to take a couple questions. I think we actually have a few minutes, and I did say that I would do that. So I know I spoke a ton at you, but if there's comments or questions from the room, I'm happy to do so.
We do have microphones set up in the room for those who do want to ask questions. And I would remind you if you could use the microphones because we do have people on the webcast who would like to hear the questions as well. Are there any comments or questions for Julie? Okay, I think José's making her way to the podium.
Well, thank you for sharing your story. It's really not endearing, but I'd say you really understand what you've. Can you tell me, in these 8 years, did you see progress? I mean, were you able to use some of these technology eventually, and did you feel some of the benefits that you're talking about, and how did you see? Was this accelerating towards the end or not? Do you feel this is accelerating? I guess is my question.
Right, that's a great question. So early on, of course not. It was very much paper-based records and trying to access it and creating my binders. As I would say the last 2 to 3 years of Kate's life, we started to visit the emergency department, and our hospital had Epic. So health records were there at the nurse's station, and she was flagged with a little red flag, I'm imagining. And then a sheet would come up giving some very, very specific basics about Kate. It was called a single point of care document. So we had access to that. Eventually, my chart slowly came on board, but the access to my chart was heavily restricted. So I really wasn't able to use it in any way that was useful for our family, and was actually quite frustrated by it. That's at one hospital. We were across 3 different hospitals, both in Ontario and Quebec, and neither one of them had electronic health records or portals at that time. So very, very limited. We did get a little bit into emailing and texting, if you can believe, with some of our providers, but that was very spotty as well. Some had very strong views about emailing, and others were very open and receptive to it. And a note on emailing: when you do engage in emailing, it doesn't go into your patient record necessarily, and that's going to be the responsibility of the provider to make sure that they take that email and put it in the patient record. And there was some rich information in there. A lot of it was lost because it wasn't put into the patient record. Thank you for that question.
Hi there. Thank you for sharing your story. I wanted to know, when you eventually had access to the electronic health record of your daughter, did you notice any differences between the electronic record and the physical paper record you had to gather along the time?
Yeah, the electronic health record is basically a data dump. So it is just pages and pages and pages of printed information, and you really have to go through it quite carefully with a fine-tooth comb to try and find the information you want. When you have a patient record that was paper-based, everything is color-coded in these things, right? So there's different, well, this one isn't. It's because of photocopy, darn. These are kind of color-coded. There's pink, and there's yellow, and there's blues, depending, the yellow stuff was urinalysis, the pink stuff was blood work. So you could find things a lot easier. But I find the electronic health record, the big box of information we got, was just a data dump, and you really had to go through it quite closely. Yeah. So thank you, everyone. I think my time is up. I wish you the best. I really wanted to be able to stay for these 2 days, but I'm actually heading back to Ottawa. But you're in great hands with the patient advisors in the room, so I hope you stalk them and ask them lots of questions. And I wish you the best over the next 2 days. Happy Digital Health Week.